When you think of a nurse, you probably think bedside, hospital setting, but the role of nurse can take on many different forms. We got to meet several different nurses earlier this week. For example, some nurses take their job on the road. Rebecca Tao is a home health nurse. Her office is basically your home. She's responsible for providing care after a hospital stay. So Rebecca travels a 60-mile radius across the Central Valley, following up with patients on things like medications and doctor appointments. She says a big part of her job is education, teaching user-friendly nursing skills.
We give the caregiver more confidence, and after we do teaching with the family, and the patient would feel more confident. Sometimes when I know that they look forward for me to come in, I feel honored, you know. And once in a while, if I don't know if I'm supposed to do this, but when it's my patient's birthday and I know nobody, I give them a little cake or a little card or something. You know, just happy birthday. I know it's your birthday. You know, that's the kind of relationship you build with being a home health nurse with your patients.
Rebecca says her goal is to make sure every patient gets back to a functional level while remaining in their home environment. She believes people just heal better that way. We also caught up with Justin Ratliff, the nursing manager at Community's Subacute Transitional Care Center. The facility is considered a skilled nursing center where patients receive long-term care through physical and occupational therapy, wound care, and more. Justin's role means he is the eyes and ears of doctors and the patient's biggest advocate.
We don't have attending physicians walking them up and down the halls, so it really is nursing that's really doing the assessment, the bedside assessment, the bedside care, and then in turn notifying the physician. And then we have that great trusting working relationship with our physicians that they trust our judgment and then go forward with making a recommendation or an order.
Justin says because these patients are in long-term care, they get to know them well, and you'll often find them out on field trips like an annual trip to the fair, a Grizzly game, or just feeding an ice cream craving. Over at Community Behavioral Health Center, you'll find Carol Albert-Sorsky working behind the scenes. She's a utilization review coordinator working with insurance companies to ensure payment is made for the services they provide. Carol has been a nurse for more than 30 years. In her current role, she evaluates medications, dosages, and doctor's notes in order to better advocate for the patient and community as a care provider.
There's nothing more rewarding than knowing as a team we're able to help stabilize a patient and help a family member return to their home with their own family. And you want to do it because your heart wants you to do it, not for a paycheck. You know, you have to want to do it because you care about the patients.
She says one of the most important aspects of her role is to make sure her patients and the community are kept safe. And finally, we meet Andrea Lee Riggins, a clinical nurse specialist at Fresno Heart and Surgical Hospital. She does practice bedside and then some. Her title means she's a licensed nurse with a master's degree. Her advanced training allows her to not just provide care, but assess and evaluate a patient. She says she wears many hats, including researcher, nurse, provider, educator, and leader, communicating between patients, families, hospital leadership, and clinicians.
I can actually make a closer connection, I think, with the nurses at the bedside, who I think are our grassroots clinicians, our end users, in order to try to figure out what's going on with them, try to figure out what their barriers, their challenges are, so that then we can try to figure out how to help them overcome those challenges and then work with them to try to make improvements.
Andrea says at the end of the day, it's all about improving practices for you, the patient. Nurse, by definition, you can see, is a broad term, but it all boils down to one thing: care. There is certainly no shortage of that in any capacity in our community.